Certain aches and pains could be signs of long COVID. Doctors are seeing a rise in cases. They suggest that the easing of restrictions makes room for easier transmission of the virus. Thankfully, the severity of the virus has reduced and the death rate has dropped considerably. However, the virus is still worrisome. Let's take a look at these 5 points. 1. What we know about long COVID. Long COVID symptoms vary and do not have a set of specific diagnostic criteria, which makes it challenging to identify. If you've been infected with COVID before, then there's the possibility of having this disease. People need to be aware that long COVID can have a lingering impact and that it can be difficult to tell which symptoms are signs of long COVID and which might be due to different causes. 2. COVID and the flu. Although many people equate COVID to the flu, many doctors say it is not. They say COVID-19 and the flu have similarities and differences. COVID-19 and the flu can result in severe illness and complications in those with increased risk, such as older adults with underlying medical conditions. The differences are that COVID-19 seems to cause more severe illness in some people, and severe COVID-19 infection can result in hospitalization and even death in healthy people. 3. Uncharacteristic depression can be a sign of long COVID. According to Dr. Hospitalization, anxiety, depression, stress, and similar conditions related to mental health can increase the chances a person will experience long COVID. Unfortunately, having COVID could predispose people to depression. 4. Myalgia, hurting muscles. Dr. Hospitalization says, muscle pain, myalgia, can mean you might be a long hauler. COVID infection can damage muscle fibers, affect your immune system, or contribute to clots that impede blood flow through the muscles. Pain may last for a few extra weeks or may linger for months. And 5. Continued, returning, or new symptoms, such as chronic fatigue, cough, shortness of breath, or chest pain, is an indication of long COVID. If symptoms after acute COVID have not gone away after 4 weeks, such as cough, shortness of breath, or chest pain, this may indicate that you may have long COVID. COVID is still a major concern in the U.S., as deaths continue to be reported. Long COVID is another concern virus health officials have. The Centers for Disease Control and Prevention states, new data from the Household Pulse Survey show that more than 40% of adults in the United States reported having COVID-19 in the past. And nearly 1 in 5 of those, 19%, are currently having symptoms of long COVID. We're Artisan Health, compassionate care with a functional mindset. Get to know us better at artisan.health.